Hi, welcome back to Undefined Truth. Today I'm going to be telling you 10 questions that may help you better understand if you're struggling with normal sadness or if you may actually have some depression symptoms. If you want to know what these 10 questions are and what depression tests I'm using to talk about this, then keep on watching. So I want to start off by saying that these 10 questions do not replace, I repeat, it does not replace a full assessment with a licensed professional. These 10 questions are just to give you a little bit more understanding if maybe it may be helpful for you to actually go see a licensed professional because there are some warning signs. Now, before we jump right into the test, I want to encourage you to hit that subscribe button somewhere down below for you to never miss a video here on Undefined Truth, where we make all things mental health. So let me just give you a brief definition of what depression is. It's a sense of hopelessness, helplessness, of not feeling worthy that lasts for days and even weeks. So this test actually comes from mentalhealthamerica.net. What I liked about this test is that it gives you a scoring. So if you want to track your symptoms or how you're feeling, you're able to go back to the same test a week, 2 weeks, a month, and kind of just see what you scored then versus what you scored now. For those who are visual and auditory learners, I'm going to swing on over to the website so you can actually read along and see the questions as I say them out loud. Question number 1, little interest or pleasure in doing things. Number 2, feeling down, depressed, or hopeless. Number 3, trouble falling or staying asleep or sleeping too much. Number 4, feeling tired or having little energy. Number 5, poor appetite or overeating. Number 6, feeling bad about yourself or that you are a failure or have let yourself or your family down. Number 7, trouble concentrating on things such as reading the newspaper or watching television. Number 8, moving or speaking so slowly that other people could have noticed. Number 9, thoughts that you would be better off dead or hurting yourself. And question number 10, if you checked off any of these problems, how difficult have these problems made it for you at work, home, or with other people? Now, after you've answered these 10 questions, it will show you a brief questionnaire that you can just breeze past and hit submit, or you can actually answer them, but it does not affect your scores. So if you answer not at all, that's 0 points. Several days, that's 1 point. More than half the days, that's 2 points. And nearly every day, that's 3 points. Now, based on your total score, it will put you in the range of depression. So 1 to 4, minimal depression. 5 to 9, mild depression. 10 to 14, moderate depression. 15 to 19, moderately severe depression, and 20 to 27, severe depression. Now, as I shared earlier, I really like this one because you can track it as many times as you want over the course of a year, 6 months. And then if you feel as though it is severe enough or impacting your life enough, you can go and seek help and take some of these questions that you've answered. And based on your answers, you can talk this over with a licensed professional. So I do want to say this, that even if you take this exam and you fall in the range of minimal depression, don't take that and just not go seek help. You are the expert of you. You know yourself better than anybody else. So if what you're struggling with is enough to impact you, where you want to seek help, where you want to talk to somebody, please go do that. You do not need anybody to validate what you're going through or how you're feeling at this time. This test is just to see if there are some warning signs for depression, but if you are wanting it, go get it. And go get it, go get help. So I hope you found it helpful to look over these 10 questions with me and just answer them and see how you can go about taking this test on your own. If you like this type of mental health test, then I encourage you to hit the like button so that I know you like these type of videos and I can make more. Don't forget to subscribe down below so that you never miss a mental health video here on Undefined Truth. And of course, as always, if you are out there struggling right now, don't suffer in silence. Please, please, please click the link down below for you to reach out to a mental health professional in your area or online. And I think that's it. I'll see you next time here on Undefined Truth.